Well, good evening, everyone. It is 6:30 p.m. and welcome to the Coconino County COVID-19 Town Hall. I'm Public Affairs Director Eric Peterson. I'm glad you're with us tonight. Before we turn it over to our county board and the moderators of this event tonight, just going to go over a few functional pieces for you and some information. So let me pull this up so you can see it on your screen. Thank you to all of us who are joining us on NAU TV and also on YouTube that are streaming along with us. So just briefly, we do have the Zoom interface for those who wish to ask questions tonight. Please type a question in the Q&A function or raise your hand to be called on to speak. Those controls are at the bottom of the screen. Our IT department is working right now to try to figure out our Spanish language interpretation. We apologize. The feature should be available. We will make note of it as soon as it is. So I'm sorry that it is not available at the moment. Went through fine on the test this morning, so my apologies. If you do have questions or comments and are watching on NAU TV or are watching on the YouTube stream, you can comment on YouTube. We'll pull those comments in, or email board comments at coconino.az.gov, and we will pull those emails up. As you can see, I have a couple computers here, so I'll be moderating tonight and helping to pull questions in. Again, we appreciate your involvement in this meeting. We really are happy that you're with us. I'm going to turn things over to our County Board Chairwoman, Liz Archuleta.
Well, good evening, and thank you very much, Eric, and good evening to everyone in Coconino County who is joining us for tonight's live meeting. We really appreciate you taking the time out of your day to be with us this evening and making it a priority. This is our Coconino County Public Town Hall. I'm Chairwoman of the Board of Supervisors, Liz Archuleta, and also the Supervisor of District 2, which covers the southern and eastern portions of Flagstaff, including Southside and Sunnyside and out to the Timberline Fernwood neighborhoods. Let me briefly start by indicating my thanks to the entire Coconino County workforce for the quality of the public health and emergency response we have mounted to the COVID-19 pandemic. Coconino County led the state as the first county to open up drive-up testing, the first county to obtain a non-congregate facility for isolating those who are positive or may be positive and are housing insecure. And we were the first county to create a social services coalition to better meet the needs of our residents. I want to extend my thanks to all of the medical personnel, the doctors, the nurses, the first responders, law enforcement, fire responders, all of our teachers and educators, and as all of the folks who are continuing to provide all of the community services. Our efforts at Coconino County have helped to identify the spread of the COVID-19 virus, provide services to persons and communities affected, and generally to be a place of solid assurance and resources for the public. Thank you to our team for the response you have led. Thank you to our public servants that have been directly and indirectly supporting our COVID-19 response, from working in the Emergency Operations Center to assisting with processing rental assistance applications, which have seen a tenfold increase, to serving at the testing sites, including this past Saturday, where we had almost 300 persons tested. This is a special session of the Board of Supervisors, so I will call this meeting to order. All 5 supervisors are here present for the meeting. So if you would please stand if you are able and join me in the Pledge of Allegiance. And a flag will appear on the screen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Chairwoman, if I may, before you begin, I have one more moderator comment.
Yes, go ahead.
So again, folks, I will start to say that this is a public meeting. There have been a couple comments in the chat that are racially demeaning. They will not be tolerated. We will push folks out who make such statements. I apologize that I cannot delete the chat, however, so I do apologize for some racially insensitive words that have been posted. We have removed the participant, but again, just so everyone knows those ground rules going forward, we will not allow that kind of material to happen on this event. So thank you all.
Thank you, Eric. Appreciate that. Now I'll ask each supervisor to introduce themselves. We are going to be quick so we can get to your questions and discuss the issues that you want to talk about. I'd like to first call on the Vice Chair of the Board, Supervisor Lena Fowler. Supervisor Fowler.
She's on mute.
Okay, Supervisor Fowler, if you will just press the
Sorry.
unmute button. Super, thank you, welcome.
Hi, yes, I'm Lena Fowler, Coconino County Supervisor for District 5, and I represent 7 Navajo communities, City of Page, Fredonia, Vermilion Cliffs, and the North Rim region. So I like to just welcome you all to our Zoom Live, and every day we are working on behalf of the Navajo Nation communities because they have been really hit hard and really impact our relatives out there. And I just want to reassure them that we are working with them, all the communities on a daily basis. Thank you.
Thank you very much, Supervisor Fowler. And now I'd like to turn it over to Supervisor Art Babbitt, Supervisor of District 1.
Thank you, Madam Chair. Don't want to take time. I just want to recognize the sacrifice that businesses, families, school kids, and all of us have been going through and understand that as we try and serve competing interests, sometimes that are in direct competition with each other between public health, economies, and the welfare of our communities, they're difficult decisions. Thanks for the sacrifices you've made, and thanks for being part of this conversation. I hope you get information that's valuable to you, and you have the opportunity to ask questions and come away better informed. Thanks very much.
Thank you, Supervisor Babbitt. And now I'd like to turn it over to Supervisor Matt Ryan, who is the Supervisor of District 3. Supervisor Ryan?
Excuse me. Thank you, Madam Chair. And I represent pretty much the southwestern section of the county: Sedona, Williams, Southwest Flagstaff, Kachina, Mountain Air, Munns Park, Parks, Belmont. You always forget a child out there, so I apologize if I forgot one of our children, our wonderful communities. But important piece, we all have been working really hard together with staff, with community partners, our health department, with the medical community. You can see that we've taken a data-based approach to what's happening. Pandemic, community transmission, no vaccine, limited tests, a lot of challenges out there. And on the other side, businesses that are being impacted on the economic side, people struggling when they may not have their job, and what do you do next? So we are really concerned for the community. We've continued to be proactive. Example would be the fire ban based on Forest Service fire districts and departments asking us to go along with the open fire ban. It seemed to make sense. It's very difficult for them to respond to emergencies if they don't have the manpower. So there are many fronts that we've been working on at the legislative level. We want to thank everybody for their cooperation, their understanding, their patience and perseverance. And you'll see tonight that we have a lot of support elements and provide the opportunity for you all to ask questions. Thank you, Madam Chair.
Thank you very much, Supervisor Ryan. And now I'd like to turn it over to Supervisor Jim Parks, who represents District 4. Supervisor Parks? And if you'll just unmute your line, and then you'll be ready to speak.
Madam Chair, I'm not seeing Mr. Parks come in yet.
Okay, that's fine. We will give him an opportunity, perhaps towards the end, to extend a greeting. Thank you very much. So thank you all for, again, joining us tonight. Dr. Marie Peoples will join us shortly for an update on the public health data trends, and response to the COVID-19 pandemic. But first, I want to quickly review that the county is operating under the governor's executive order, which allows for some businesses to reopen this week. Retail will begin in-premise operations on Friday, as well as barbershops and salons. Starting next Monday, the 11th, restaurants will be open for dine-in service. There is specific guidance from the state for those businesses and guests to follow, and that is available on our county COVID website. And you'll see that there's a link that will be put on the screen. That website is www.coconino.az.gov/COVID, COVID-19. Once again, that's www.coconino.arizona.gov/COVID-19. And you'll see that. Also, if you would like to call, you can do that as well. If you do not have access to the website or you prefer to call in to get information, we do have a call center that is available Monday through Friday from 8 a.m. to 5 p.m. That call center number is 928-679-7300. 928-679-7300. And we do have Spanish interpretation available on that line as well. Dr. Peoples will address this more specifically, but Coconino County has not seen a 14-day decline in the number of positive cases, which is the first trigger to relaxing these standards. I encourage all residents to be cautious and practice the sound guidance to prevent transmission of COVID-19. This means frequently washing your hands, wearing a mask, and avoiding touching your face when out in public. We are preparing to communicate to the governor's office that a one size does not fit all, and a one-size-fits-all reopening does not meet the reality we see in Coconino County. As Dr. Peoples will point out, we have a much different scenario here than the state numbers. We know that businesses want to reopen and workers want to get back on the job, and we are balancing that desire with efforts to prevent a surge in cases in a few weeks. We will continue to advocate with the governor for a solid plan from the state and for local control to make decisions that meet our needs. We also know that many people and families are enduring difficult times associated with the pandemic, from possibly a spouse being laid off or family business struggling given the change in our economy. I would like to provide some resources that may be helpful. First, the county has joined forces with United Way of Northern Arizona to create a social safety net services coalition. This is a coalition of nonprofits and other agencies that provide social safety net services in our county. The coalition is a forum for facilitating communication and more effective services to help respond to dramatically increasing service needs. The coalition has produced a social services resource guide, which outlines services available in the areas of food, housing, and emergency cash services. Secondly, the county has led webinars on accessing business resources and has information for business owners about the federal and state programs available to businesses. To access the resource guide or the business resources, please go to the www.coconino.az.gov /COVID-19,
coconino.ac.gov
or you can also call the county's
y también te
COVID-19
puedes llamar el centro de llamadas del condado de
at
Coconino a
928
928
679
679
7300.
7300. Y tenemos también personas que hablan español ahí.
So I want to go ahead and point that out on the screen again. This is again your central place for information, whether it be accessing the social services resource guide or the business resources. And you can also call. Finally, I want to make sure the public has the facts for Coconino County when it comes to state and federal funding. We are America's second largest county geographically, and to date, we have received just a few $1,000s from the massive state and federal funding bills that have been passed. We are advocating to get more, but as county taxpayers, we are really financing the response to COVID-19 here on the ground. So your voice with elected officials will be needed to help us pay for the work we have to do. We have created a COVID-19 funding task force to track all the expenses as well as funding possibilities, and we will continue to press the governor and the federal government to fund this response at Coconino County. And now I would like to turn to Dr. Marie Peoples for an update on the public health data, response, and critical issues. Dr. Peoples?
Hi, thank you so much, Chair Archuleta and Board of Supervisors. So you framed that well for me. So just an update on the Coconino numbers. As of today, we have 608 positive cases. 103 of those are within Flagstaff. And as Chair Archuleta alluded to, we have not seen a downward trend, especially over a 14-day period. Of those 103 cases in Flagstaff, 17 are new of those today. So if anything, we're seeing an uptick in cases. Our tribal communities stand at 414 cases, and Page has 80 cases. Unfortunately, we have lost 49 community members to COVID-19. So as Chair Archuleta shared, we have operated and launched a full-scale emergency operations center. We are in week 8 of having the full-scale operations center launched. We have continued providing safety net public health services, including rental assistance and housing assistance, along with linkages to other needed community services. We have also extremely proud that we were the first in the state to stand up drive-through specimen collection sites, and that we operated a 7-day-a-week call center. We have scaled that back now that we are in week 8, and because the state has also launched some 24-hour access care lines for providers as well. So that has been a tremendous help. But the county continues to be a leader in this space. We were also the first in the state to launch our isolation and quarantine hotel. The focus of that has been on housing insecure individuals to reduce the spread of COVID-19 within our congregate sheltering settings. And we are convinced that we have seen some real positive data within those numbers, within those settings, both congregate shelters within our jail. So we've done a lot of things that have helped quite a bit. Just a little information on the drive-through sites. We're operating Fort Tuthill Monday through Friday from 10 a.m. to 3 p.m. We're also participating in the statewide testing Blitz, which is over 3 Saturdays. We had our first participation last Saturday. We collected 287 specimens. We will participate again this Saturday. It will be at the King Street Health and Human Services location. The hours will be from 10 a.m. to 3 p.m. And if people aren't catching this, all of the information is posted on the website. They can also call the call center to get additional information. But we will be operating 2 drive-through testing sites, and we will also have 2 walk-up testing sites for community members. So with that, I want to be able to thank all of our community partners. We have had so many people that have pitched in, including our hospitals, our sheltering communities, are all of our nonprofits, and of course, their city partners. And the response that we have experienced through the Emergency Operations Center has truly been a one county response. So thank you, and I'll look forward to taking questions. Chair Archuleta?
Thank you, Dr. Peoples. I appreciate that information. And again, looking forward to the questions. And as we transition to the question and answer period, I want to share that there are many, many unknowns at this stage, and we are committed to sharing with you what we know and to best answer your questions. I want to also acknowledge that I understand that the uncertainty surrounding this time that we are in is very unsettling and even upsetting. We are here to listen and to take your input and your feedback. And so now I'm going to turn it over to Eric Peterson, our Public Affairs Director, who will facilitate the question and answer period. And he will again let us know how that can happen. I know that we already have some question and answers that have been written to us, and so we will certainly begin and take some of those, and then we'll see what other methods there are to be able to answer the question and answers once Eric tells us how to do that. So Eric, go ahead.
Thank you very much, Chairwoman Archuleta, members of the public who are with us tonight. We really appreciate you being here. Again, on the bottom of your screen, Q&A, enter a question there. We have 5 questions in so far. You can also raise your hand. That will literally show me a raised hand, and I will be calling our first question. Actually, will be a live question from that that we'll call up here in a second. Want to remind folks, we do have our YouTube feed running. And so please leave us a comment if you're watching on YouTube. And if you're at home watching on NAU TV, you can email board comments at coconino.az.gov. Board comments at coconino.az.gov. We did, again, just a reminder, should you engage in a question tonight, we are asking folks to be respectful. We've had some racial language in the chat. We have turned the chat off. Also removed members who make such posts, and we will banish such posts as well. That is county policy. So I just want to remind everyone of that, that we're here to engage and hear the public's feedback, but do so respectful of all the citizens in line with the values of Coconino County. So with that, Madam Chair, I think we're ready for our first question. We are going to go to a live question. Actually, I'll make one more comment. We do have our Spanish interpretation working. So at the bottom of your screen, you'll see interpretation. If you wish to hear it in Spanish, just click Spanish. You'll hear our interpreters with the main speaker at a muted volume below that. So our interpreters are working hard. And we also want to thank our ASL interpreters who are providing service tonight for those of our hard of hearing community. So with that, our first question comes from S. Smith. I'm going to turn on your microphone, so please go ahead, S. Smith. I guess they're not there, so we'll move on. We'll come back to them in case they come back. Our first question then will be on the post. I think Dr. Peoples is prepared. Will antibody tests be available for anyone who wishes one? Knowing who has been exposed can be very helpful.
Well, thank you so much for the question. And I'm sorry, I didn't hear who it was from. But antibodies are definitely top of mind for many individuals. And I don't know if they will be available for everybody. As we have seen, the supply chain is very tight on certain materials and tests right now. I do know that there are a couple of local entities right now, Sonora Quest and I believe TGen as well, that are offering antibody testing. There is a fee associated with it. And it's under $100. I'm not sure of exact fees, and I'm not sure of how the insurance is working. So I will speak to the county. Currently, the county is not offering antibody testing because these have not been made available to us either through our state or federal partners. It is something that we're incredibly interested in doing, and we continue to research it. We bring it up whenever we have our state calls to ask what those next steps are. And even just being able to do a cross-section of the population would be incredibly telling and interesting for us to do. We do continue just in terms of regular testing to know if people currently have COVID. We are certainly currently still in that space trying to source additional kits so we can help make that more widely available to all community members. Thank you, Mr. Peterson.
So stay with us, Dr. Peoples. I'm going to go to a YouTube comment from a Norman Parrish question. Is testing open to everyone or just those that are showing symptoms? Also, do we have to register on site, then show up, or do we just show up for those tests?
Great, thank you. So the Monday, it's a little confusing, so I really appreciate the question. The Monday through Friday testing at Fort Tuthill still falls under the state guidelines, which does require that people be symptomatic or have doctor's orders. If you are symptomatic but do not have doctor's orders, then you can go to Fort Tuthill and you'll be able to be screened and receive a specimen swab at that point in time. The Saturday testing blitzes, also through the state of Arizona, those are open to everybody. The only criteria is that you have to think that you've been exposed to COVID-19, which certainly is not a stretch since we have been identified as a state that has widespread transmission. And certainly Coconino County has also been identified. So again, Saturday testing blitz, the Saturday 10 a.m. to 3 p.m. is open to anybody. The Monday through Friday at Fort Tuthill, still following state guidelines, you need to be symptomatic or have doctor's orders. And we hope that that will change. And as we continue to source kits and as the state of Arizona moves forward with testing, we are advocating for additional access for individuals to be able to have testing. Thank you.
All right, thank you, Dr. Peoples. This will go to the board members, but also to Dr. Peoples if you want to answer. What, if any, plans are there to keep those of us who are 65 plus with a medical condition, I'm assuming safe, after the government opens businesses up? And it's a question from JP.
I'll jump in. I'm not sure if that question is directed towards Coconino County employees specifically or across just the general workforce across the county. So I can start the conversation in terms of Coconino County. So we are working on making it a safe and full return for all employees, regardless of age and regardless of medical condition. Each of the departments have been asked to provide a reopening plan, for lack of better words. And the plans are incredibly thoughtful and detailed. Each of the department directors and elected officials have taken great care to think about their workforce, how they can have social distancing within their work settings. And then within the Emergency Operations Center, we are also looking at how can we provide masks, hand sanitizer, which our facilities department has been terrific in sourcing materials very early on in this event so that we can mass produce our own hand sanitizer. So we are keeping it first and foremost to make sure that employees do return to work in a safe environment. We're also trying to figure out how we can offer some testing, especially to our high-risk workers, and not high-risk workers per se in terms of medical conditions, but perhaps those that are exposed to the public even more. So we're definitely working on those plans. And then I would turn it over to the board if there's a general county response.
I'm sorry, Marie? Hi, yes.
Ma'am.
Okay, super. Thank you so much. So would you please repeat the question again for me, please?
Oh, absolutely. So the question, and it was a little vague. So the question was, what are we doing to make sure we keep our workers over 65 and with medical conditions safe? And so I shared what the county's response was and what we're doing for our county employees, but I was unsure if the question was more geared towards in terms of policy or proclamation as people return to work out across the county and in the cities.
Sure. So I do see another question from another individual about is the county going to continue to follow the governor's guidance? And so I think I'm going to go ahead and fold it into that question as well, because I think it does pertain to both of it. So if you don't mind, I'm going to go ahead and Eric, if you would please ask the question about the county and the governor's executive order.
And we have a couple of questions on that theme, so I'm going to bucket them all together. And but the question from Scott Sawyer and from others essentially goes along these lines. Is the county planning to continue to follow the state's guidance on business opening, or is there a chance the county will run at different speed, pace than the state for business shutdown or open?
Okay, great. And then did you want to ask the other question that was similar
Certainly,
to that?
Yep, that are in the same regard. If everyone just bears with me. I'm going to find it. There it is. I can understand why the public is anxious to, this is Michael McCarthy. I can understand why the public is anxious to open the economy in Coconino with all of the benefits that brings. However, I'm struggling to understand why people are resistant to taking simple steps to keep themselves and others safe while in public. For example, by wearing masks. We're shopping at Kroger earlier today and fewer than half of the shoppers were wearing masks. Has the county considered implementing regulations around this as they have done in other regions of the US? Thank you for your time. And then there's a couple specific to salons and hair salons. So I'm going to let that one go to another question. So those are the two that are together in that theme.
Sure. Okay, great. So I think I'm going to take the one about the governors, and then probably ask Dr. Peoples also to weigh in on the one about what measures can be taken in terms of for shopping and to be out in the community. So so let me say this, and that is that the county government falls under we are an arm of the state, but also government, whether it be all local government is subject to the governor's executive order. So that means that we need to follow that order. And we are under that order. And although we did have a proclamation that it did expire on April 1st that put certain restrictions and regulations in Coconino County. Although that did expire, it basically, the governor's executive order supersedes that. So even if the county wanted to go at a different pace or to put additional restrictions, we are not able to do that. So what we do have at our disposal is to provide information similar to what we're doing right now, to provide the data, to make sure that people understand the science, and to educate. And so that means that we want, as I mentioned earlier, we are sending a letter to the governor, and we are in communication with the governor and with the Arizona Department of Health Services about what we are seeing in Coconino County. In fact, we are in continuous communication with them to let them see what our numbers are, to share our concerns about the fact that we are seeing increasing numbers, that our brothers and sisters on the Navajo Nation who are part of Coconino County are experiencing alarming numbers, and that it is not a one size fits all. And so although we cannot do anything to basically overstep the governor's executive order, we can be smart ourselves in our community, and we can provide you the information that you need, and we can ask you to remain vigilant about following CDC guidelines. And that goes for our vulnerable populations, people who are over 65 years old, who have a compromised immune system, that we ask them, to the extent possible, to continue to stay at home and to be safe. Thank you.
Thank you. So Chair Archuleta, you covered that excellently. I would just add that while we cannot compel people to wear masks and the other safety protocols, we certainly do encourage it. And so I would definitely recommend that as people continue to go in public spaces, that they do continue to wear their masks, and that when you're not able to have hand washing, sinks, access to soaps there with you because you're out and about, I do encourage people to continue using wipes and to have the hand sanitizer readily available. We know that this virus is still present in our community. And while the weather is nicer and people are out and about and the restrictions are lifting, again, we have not seen that 14-day decline. And if anything, definitely within our own community and across the county, we're seeing increases. Just as a reminder, we have the increase of the 17 cases. So again, I really encourage people to take all those precautions and to have that self-accountability, take care of themselves, take care of our neighbors, because when we wear a face mask and when we're using the hand sanitizer, it's not just for our protection. It helps those that may be vulnerable that we come into contact with. Thank you.
Thank you, Dr. Peoples. We are going to go to the board quickly. This is a question coming in from YouTube. Can Chairwoman Archuleta describe in more detail what money, what should be available to Coconino County that has not yet been received from the state? Chairwoman Archuleta?
Yes, thank you very much. I'm sorry I was on mute. I just needed a minute to unmute, so I appreciate that. Sure, I can speak to both the state and federal money. So first of all, when an emergency is declared, the county makes that declaration to the state, and then the state determines if they declare an emergency as well. And the state did declare an emergency. When that happens, then the state does provide funding to counties to be able to, for example, operate the Emergency Operations Center. That usually we can be reimbursed for some of those costs, either through the state Department of Emergency Management and also through the federal emergency management, FEMA. But the unknown is that it's not a guarantee. We don't know if we'll be reimbursed, at a 50% rate, at a 75% rate, or 100%. We do not know that, and the money usually doesn't come in immediately after. So what that means is that the county has to basically front the money that is required to respond to an emergency. And sometimes that funding doesn't come in, even a year later. For example, when we had the Schultz fire and flooding, we didn't get reimbursed for many of those costs until 3 years later. So that creates a cash flow issue for the county. It also creates uncertainty when we don't know if we will get our costs reimbursed. But that is on the shoulders of the county to be able to front the money during an emergency. Secondly, I did want to speak just briefly to the federal funding. So for the first stimulus package that Congress passed, there was a direct allocation to Pima County, to Pinal County, and to Maricopa County, straight from the federal government in that package that was passed. There was some money that was then awarded to various states and those states would determine how they would distribute that money to the remainder of the counties. So the state of Arizona did get a direct allocation as well out of that stimulus package. We have yet to receive some money from the state, although the other 3 larger counties, because they got a direct allocation, received funding. Then there was the next stimulus package. It was called the 3.5 package. In that package, our National Association of Counties and every county across the nation advocated vigorously to include funding for counties in that package. And although we advocated very strongly, ultimately counties were not included in that package. So there was no funding at all for counties in that stimulus that passed. So now we understand there may be another one, although that's very, very uncertain. And we continue to advocate strongly to ensure that funding for counties is in the next package. But again, there are no guarantees.
Thank you very much, Chairwoman Archuleta. Moving on, we will actually go to Everett, who has raised his hand. So Everett, you are now able to talk. Go ahead and ask your question. Unmute yourself if you can, Everett. All right, well, we don't have Everett, but that's okay. We will go to Linda. Linda has a question. Linda, are you there? Linda, we can't hear you. All right. Oh, Linda, are you there now? Well, we'll hold those folks and we'll go back to our questions and answers as we get folks. Remember to unmute yourself when you're ready to talk. Let's go. Dr. Peoples, a couple questions about cases and trends. A couple questions here. Has Arizona State shown a 2-week decrease in COVID-19 cases that sounds like it has not been met in Coconino County? And then a similar question, both anonymous questions. Do we have an idea or model for when we may have a 2-week decline in cases?
So thank you, Mr. Peterson. So the state of Arizona, that's a difficult question to answer because the test results are being updated on the state website at different times. For instance, the Blitz results for each of the counties and it was wider than just counties participating. It was also open, just for example, to commercial laboratories, to retail type industry, Walgreens, CVS. So there were a multitude of entities that participated, and all of those results are not in yet. So it's really difficult to tell what type of trend is happening across the state. And there may indeed be some jurisdictions across the state that show a decline, but for the whole state, I'm not sure. And that really gets to what Chair Archuleta was sharing when she started, is that in terms of our county, we know that we're not seeing that. And so while the governor's orders are statewide, our county has some unique concerns, as will those other jurisdictions. And then Mr. Peterson, if you can remind me to the second part of the question, please.
Is there a model that we will see here for Coconino County on when we get there?
Yeah, thank you so much for that. So there are several models that are out, and several of the models have gained more traction, others not so much. As everybody can imagine, this is really difficult to predict. And part of the difficulty in predicting is the limited access to testing. We know that many people that have indeed been sick or asymptomatic have not had access. So that makes it difficult for scientists and researchers to be able to develop a model. I am proud to share that we worked with Northern Arizona University, the Center for Health Equity Research, their epidemiologists and other types of scientist researchers. They have not so much developed a model, but they looked at many models and took different factors for Northern Arizona and the state of Arizona into account and shared some recommendations based on what we might see. And all of those materials are available on our website along with an executive summary. So I would encourage anybody that's interested to take a look at those. But the short answer is that we are not out of the woods yet. And all of the modeling that I am familiar with shows that we'll continue to see cases. And it could be as long as through the end of the year. So it's hard to say, what does that mean for Coconino County in terms of reopening? And so again, the best guidance that I have is to continue watching our 14-day trend across several different spots across the county and monitoring those. This is going to be extremely difficult as we do open back up and we have an influx of visitors in that want to enjoy our beautiful county for recreating and other purposes. So we may indeed continue to see an uptick in our county. Thank you.
Thank you very much, Dr. Peoples. We are going to see, Linda, are you there now?
Yes, can you hear me?
Yes, go ahead.
Yes, can you hear me?
Yes.
Actually, I have two questions. First question is, why would you get tested if you have no symptoms? And second question is there a list somewhere that tells us what we're allowed and not allowed to do?
Great, thank you, Linda. Why would you get tested if you have no symptoms? And then there's a list somewhere that tells us what we're allowed and not allowed to do. Thank you, Linda.
Thank you. So many people want to get tested for different reasons. And with this virus, what has been so cunning about it is that there are many, many people that are asymptomatic, show no symptoms, they feel just fine, they're living their normal daily lives, yet they are COVID positive. And we are seeing increases of that across the nation. I believe Yavapai County had a really interesting newspaper article about that within the last few days. And I can't recall the name of the organization, but they had several people that tested that had no symptoms. And they were all asymptomatic and they had a multitude of positives. And I share that because we're seeing this across the nation, but sometimes it hits closer, when it hits closer to home, it has a different meaning and value to us. But you also may want to be tested even if you're asymptomatic because of the work setting that you're in. Perhaps you work with a high risk population or you interface with the public quite a bit, or perhaps you have individuals and loved ones and friends that you live with or see often that are immunocompromised in some way. And so it's just maybe good to know. So I would encourage people, please do come out on Saturday. We want people to get tested, even if you are asymptomatic and feel just fine. Thank you.
Great. Thank you very much. And we're going to go to a board comments at coconino.az.gov email question. There's some personal information, so I'm just going to use the first name. This question's from Orlando. He says, 3 out of 4 members of my family were sick with a viral illness in late January. I know that community members in Flagstaff were also sick with the same illness at the time, and symptoms were similar to those of COVID-19. Is it possible that this illness was COVID-19? Again, this is back in late January.
And that's likely for Dr. People?
Yes, I'm sorry, Dr. Peoples.
Mm-hmm.
Yeah, I'm here. So is it likely that people were COVID positive towards the end of January? I had a little trouble hearing on that one. Did I capture it?
Yeah. Exhibited symptoms similar to COVID-19 in the late January period, wondering if it could be COVID-19.
It could be, absolutely. We're starting to see across the nation as hospitals and providers are researching back their patient load and what was happening within emergency rooms across the nation. You know, at one time we thought that our first cases were appearing, in March, and then we learned that, oh no, in certain areas of the US, we had cases in January. And now we're finding out that there were actually cases in the US as late as last year. So absolutely, and which is really important for us to have the antibodies and for people that have had illnesses that aren't otherwise explained by general medical history to be able to have the antibody testing. So it is absolutely possible that somebody who felt ill in January could have indeed perhaps had COVID.
And while we are on the topic of antibodies, we'll go back. We have a couple of questions here. Again, a reminder, are there antibody tests available? What's the likely timeline on antibody tests and such? We've had a couple more come in. I think we answered that earlier, but just if you want to give us an update.
Yeah, I'm so sorry. We do not know when antibodies are going to be more readily available. We continue to work with our state and federal partners to try to source antibodies, to learn if these are going to be made available to health departments and health districts across the state, when those will be available, and if they're not, available free of charge, what might the cost be? And there's just no information on that at this time. And and in that case, it's not because I believe our state and federal partners are not being responsive. There's just such a limited supply. And then additionally, the efficacy of those antibody tests, as people have probably seen in the news, has been quite questionable. And we don't want to deploy an antibody test that is not known to be valid and reliable. So we're continuing to work in that arena. And I wish I had more hard answers to tell people. Believe me, we want antibody testing as well. Thank you.
And Dr. Peoples, while you're there, sorry, I'll get unmuted. Joyce Davely asks, how many of the 608 cases mentioned had underlying medical conditions as part of the COVID-19 illness, underlying medical conditions?
Oh, excellent question. So we do track that because, of course, we do the disease investigation and tracing with those positive individuals. I don't have those numbers in front of me, Mr. Peterson, but we can definitely share that out. Any questions I don't have answers to tonight that people ask, we can do a Q&A type form on the internet. We can repost the questions on our website and provide the answers. And so I can provide that.
Thank you, Dr. Peoples. And on that point, so everyone knows, we will be posting, if your question doesn't get asked tonight, we have plenty more time, we'll get to more questions, but any question not answered, and all those that are answered will be incorporated into our FAQ and made available to the public on our COVID-19 website. So we'll be doing that. Let's go to the county board and some members. There's a couple questions, but one of them, a globally management team as well, if you're willing. What is being done at the county or state level to attract more healthcare staff to Northern Arizona to help manage the pandemic? That is a question from Shanna Again, what is being done at county or state levels to attract more healthcare staff to our area in Northern Arizona to help manage the pandemic?
Great question. Jimmy, do you want to take that first in terms of speaking from the county level?
Yeah, thank you, Madam Chair. And thank you for the question. At the county level, we have similar challenges with attracting healthcare professionals, both in our Health and Human Services team and in our adult and juvenile detention facilities. So we are continuing to work with our community college partners, along with Northern Arizona University, to help cultivate the future healthcare professionals. We look at that through the lens of the county, but also I know that CCC and NAU do a great job of training up and deploying and giving internship opportunities to local residents to hopefully go into the healthcare field and then stay and serve their communities moving forward.
And I can just speak from the county, the geographic region. So the county has been in constant communication with the regional hospitals as well as the medical providers. I know that Dr. Peoples and other members of the management team have been on phone calls that were happening daily just to check in to see how many hospital beds were available, what the needs are, checking in on the staffing, and of course checking in to see if we have medical personnel and professionals if they're getting ill. And so we are in constant communication. I do know that also communication with the National Guard and asking for, we do have the ability, if needed, to be able to request assistance of additional medical personnel to assist on an emergency basis. But certainly that is a concern, something that we have our eye on. Always, again, in collaboration with the medical providers and with the hospitals to see how they're dealing with that, to look and see if there are shortages, and then to try to call on resources, not only at the state level, but I'm sure then the state could call on resources of medical personnel from other areas. I mean, we know that other states and cities within the nation have called for assistance from other states, and certainly we could do likewise if the need arises.
Thank you, Chairwoman. Supervisor Fowler, if you'll be ready, we have a question for you. Community members, this is an anonymous question, but a good one, given your district. Community members from Flagstaff want to donate items such as masks or medical supplies to the Navajo Nation. Does the county have a coordinated way to do this, or do we know of programs who are accepting and delivering items to those on the Navajo Nation? Supervisor Fowler, are you there?
I am here. Thank you.
You're welcome. Go ahead.
And I appreciate the question. Thank you so much. There's been so much generosity in donations that have been coming to Navajo Nation. Navajo Nation has an incident command in Window Rock, and Navajo Nation has also opened up and is accepting donations, monetary funds directly to Navajo Nation. It has a tax ID number that we can share. Otherwise, if there are contributions that you like to make, you can send it to contact us at the county, and we'd be able to provide you the address. And sub-office of the Incident Command from Navajo Nation is also in Tuba City. The Tuba City Command Center is at the Tuba City chapter. We have the staging ground at the Tuba City Fairgrounds, where truckloads of food has been coming in. And then, for example, like Purina Company here in Flagstaff is going to be delivering some dog and cat food to Tuba City and out to Navajo Nation. All those are recorded, and it is part of the record that is every item that is brought in. We work closely with the public health nurses, community health representatives, and they are on a daily basis going out and delivering food and other items that are needed to the people that are in quarantine or high-risk patients, or that they need medical supplies. Those are all delivered on a daily basis throughout Navajo Nation. So thank you so much.
Thank you. Supervisor Ryan and Supervisor Babbitt, if you are prepared, we've got a couple of questions. I'm going to start with Supervisor Ryan. This is a two-parter, and it'll flow into the question for Supervisor Babbitt. Can the county work with ADOT to put messages on the digital signs over the highway to let people know that we've not met our 14-day mark and to be prepared and respect our community? And that's a question from Susan. It's very specific about ADOT. The second question comes on our YouTube page about, is there a plan to mitigate transmission and super spreading events, large gatherings of people due to the popularity of our space here in Northern Arizona?
In answer to the first question, the county can always ask ADOT if we can coordinate messaging. They have pretty strict standards that they apply to their use of signs. It would have to be, since it is a state department, it would have to be coordinated with the state associated with that. Specific to that one message, I don't know if they would permit that, but we could always ask that question. And Eric, I need you to repeat that second question, please.
Sure. And Supervisor Babbitt, this is going to flow into your next question I have for you, so either of you can work on this one. But it's is there a plan to mitigate transmission of COVID-19 at the what is called by ENE a super spreading event, so a large gathering of people? Are there mitigation strategies or plans given the popularity of Northern Arizona and people wanting to recreate here in our area?
And in response to that question, while we are limited at the local level, these are questions that we ask ourselves on what we need to do and how do we rally our resources to respond. However, we are still under the executive order at the state level. We have posed that question to the governor's office and to ADHS, asking, since one size does not fit all, at least that's what we are expressing, what are the plans at the state level to coordinate for that? Unfortunately, we don't have the direct answer on that, but we are asking that question. We know there will be surges in the future as predicted or as seen in other areas. So
Great. And Supervisor Babbitt, building off of that, but specifically to your district, which represents a piece of the southern rim of the Grand Canyon and that area. Susan asked the questions regarding the Grand Canyon National Park. How are those reopening decisions being made? She has a concern that it took too long to close. So that's part of our popularity and tourism conversation we have in this area.
Great. Well, thank you very much for that. So a couple pieces on the events side of things is that we've seen a lot of events and public gatherings already close in Northern Arizona. Many of our popular festivals have either been postponed or rescheduled. And so as, I think as the trends that Dr. Peoples talked about becomes clear, those will hopefully lead to discussions on where appropriate balancing of public good and public health fit with each other. Specifically regarding the Grand Canyon, the superintendent of the Grand Canyon National Park has submitted a reopening plan to the Department of the Interior. It is the Department of Interior decision in collaboration with both state and local public health folks to put that plan, review that plan, put that plan into action and come out with an announcement. We do expect an announcement soon on when that park, Grand Canyon National Park, and also probably other national monuments around Flagstaff reopens. The good news is Department of Interior and the Park Service have been interested in, engaged, and inquisitive of public health professionals to get their perspectives. They need to be informed by good, smart public health, CDC-related strategies and mitigation pieces, and they have been in those conversations. It would be my expectation that we know about that trajectory in the next few days. That doesn't mean it's going to open, but that we know about that trajectory, and we'll see where those decisions goes. But they are consulting local folks. They do have the authority to make those decisions independent of us. I talked with the mayor of Tucson today to get their perspective. That community is preparing their businesses for a staged reopening. They hope it is staged. I had a great conversation with the county and electeds up there, and they're doing their job, which is preparing for that event to occur.
Thank you very much, Supervisor Babbitt. We're going to go to a live question. So Frank Moraga, you should be able to talk. So unmute yourself, Frank, and ask away. And then Everett will come to you next.
Hopefully I have unmuted myself over here. Hello, everyone. Thank you very much for having this town hall so we can ask these questions. I'm kind of curious about, has there been any communications with the folks at NAU? Because my guess is those students are coming from all over the country, and they have talked about going ahead and having live classes over there this fall. So what is the discussions with them? Because they could be bringing folks from a lot of hot spots that could be coming over here, and definitely raises a lot of health concerns as well.
Well, thank you very much, Frank. Thanks for joining us. Really appreciate you doing that. And I will answer first, and I'll ask Jimmy Jane, the county manager, to also comment. And so, yes, so President Chang did notify both County Manager Jane and myself of the intention of opening up in August to in-person classes. And in that communication, she did share with us that it would be all precautions would be taken. They were going to be developing plans for that. That it was going to be phased in. And what we wrote back to her was we offered all of our assistance from our public health services to help develop protocols. I know she's working with the state as well as federally to make sure that CDC guidelines will be followed and state guidelines will be followed. But we also offered the assistance of our county public health, again, to help in any way to develop protocols, to develop trainings, to develop education modules, webinars that perhaps students could be required to take before they would come to campus, protocols that we could help develop for faculty and for staff. And so, I also had a conversation with the CEO of Northern Arizona Healthcare, when we spoke about, they also spoke about offering their assistance to Northern Arizona University. And so we certainly want to partner with them and ensure the safety not only of the students, the faculty and staff, but the entire community. Jimmy, would you like to provide any other information?
Yeah, thank you, Madam Chair. So as you noted, President Chang had reached out to you and I, notifying us of the decision to reintroduce students to the campus starting this fall with the fall semester. Coconino County does have a great working relationship with NAU and has already been working with Julie Baldwin and the health professional team at NAU, on student protocols, social distancing, et cetera. So NAU has reached out and continuing to work with our Health and Human Services team. And they believe that NAU has really thoughtfully considered how to balance social distancing while continuing to provide world-class education. So it is going to have an impact in the community, but I am confident that our HHS team is working hand in glove with NAU on how to do that most effectively and, again, protecting public health and safety.
Thank you very much to the county manager and chairwoman. All right, Everett, I believe you should be there. I'm unmuting you. So Everett, are you there?
Can you hear me?
We can hear you, Everett. Go ahead.
Good. Yeah, I was fortunate enough over a week ago to get tested at Fort Tuthill, and now I understand that there's a potential that I was exposed. Is it okay to get retested like a week from now or 2 weeks from now? Is that something that is acceptable?
Great. Thank you, Everett. We did hear you. You got tested and you at Fort Tuthill. Is it okay to be retested and such that you might have been exposed after testing? Dr. Peoples is on and will answer that for us.
Yeah, thank you so much, Everett. Appreciate the question. So I don't want to get into your medical background, but if I understood correctly, you may have been negative when you were tested before. And so certainly people could have new exposures, whether through common community transmission or, family, friends, workplace setting. So a test is just a snapshot in time. And if you are negative at that time, then you certainly could be retested. And it is possible that you could be positive at a later date, certainly. I do want to share that if someone tests positive and then after a couple of weeks wants to come back and have another test to see if they're still positive, we've received a lot of inconclusive results on those, which again gets back to the need for antibodies. So again, if you've been negative but think you have a new exposure, then you could certainly be tested and see what those results may be. But if you've been positive in the past, you may indeed receive an inconclusive result after retesting. Thank you.
Thank you very much. I believe we have Supervisor Jim Parks, who's joined us on the phone. Supervisor, are you there? Just to make any comments before we continue with questions?
Yes, I'm here, and I apologize for being on late, but I will take any questions that you have for me or that any of the citizens have for me.
Great. Well, we will certainly pull you up when we get some questions. I do want to go back. There's a volume of questions, and we will answer all of these individually again throughout the day tomorrow as we post up our frequently asked questions. But there's a couple questions about nursing homes. So Dr. Peoples, our skilled living centers, our long-term care centers, nursing homes, how are they doing? How are we doing with testing in that? Are we able to provide testing in that area? Just give us a general concept for all of those questions, if you can, on where we are at in those kind of contexts and settings.
Yeah, great. It's a really important question as we consider some of our most vulnerable populations. So some of those sites have had access to their own testing, but now that our supply chain has opened up a little bit and we have access to more testing, we began reaching out to all the skilled nursing homes, some of our developmentally disabled homes, our congregate sheltering places, and have offered testing to them. So we've been rolling that out over the last couple of weeks. I can share we went to Sunshine Rescue Mission today, and did some testing there. Over 50 different specimen collection kits were collected. So we're continuing to offer that as we have additional tests available. It's going to be our top priority to continue doing that as we have supplies.
Great. And Dr. Peoples, let's just stick with you here, and then we'll pull Supervisor Parks in. I know this is an issue he cares a lot about. What's being done to prevent outbreaks amongst inmates and staff at the jail? And we'll go to you and then to Mr. Parks if he wants to talk about that.
Yeah, great. So I can share that our sheriff and the jail staff have been incredibly proactive in this area. I'm sure community members saw the press release where there's now 2 detention officers that were identified as having COVID-19 and 1 inmate. We are incredibly fortunate that we are this far into the COVID experience, if you will, and we are just now seeing positives. That speaks to the diligence that has been done within the jail. So jail staff have access to PPE. They are taking hand washing precautions. They're doing the temperature checks of staff that is not required, but best practice. We're also doing those things within the Emergency Operations Center as not just a best practice, but a requirement. So they're doing those things. When the jail staff has an exposure, just as we would treat any first responder or healthcare worker, they are able to get tested at Fort Tuthill. Then we're working with TGen. They've been a terrific partner throughout this. And TGen is working to get those results back to us as quickly as possible when we have a first responder or healthcare exposure. Now that we have the rapid Abbott testing machine, this question is very timely because we were able to do this today for the first time. We received the machine a couple of weeks ago, maybe longer now, but we did not have test kits. So we got test kits for it on Friday, and we didn't have them just because of supply chain. So we now have 174 test kits minus the few that we've used. And so there was a potential exposure that occurred within the jail, and we were able to work with the jail staff to be able to have that individual tested and to have the results back to them within an hour. So now that we're getting some additional supplies and resources, we're able to do that, and our healthcare workers and first responders hopefully won't have the 48 to 72 hour delay of being notified of what their results are. Thank you.
Thank you. And Mr. Parks, do you have any comments on that issue? All right, we will move on. There are some questions about the reopening, and I'm going to turn my video on so I can show you all that I don't need to worry about going to the barbershop or the salon anytime soon. But folks, about how do we safely go back to get a haircut and go to those salons? Are there protocols both for those operations, but then also another question about protocols on the best way for restaurants to operate and to help protect the safety of those folks that may be coming in to dine. So I'm going to, between Dr. Peoples, Chairwoman Archuleta, anyone who wants to take a shot at some of those, feel free.
Okay, super, Eric. I'm going to let Dr. Peoples speak to that. And then I would be happy to supplement any at all. And I think that Supervisor Parks also is now unmuted if he wanted to provide some more input to that last question. So if you don't mind, I'll go ahead and call on Supervisor Parks because I think he wanted to respond. So Supervisor Parks, you are on.
Thank you, Chair Archuleta. I was muted there for a minute, but the only thing I wanted to say is that I'm really pleased with the way the Sheriff's Department has conducted themselves and the jail. The jail folks have conducted themselves, and as Dr. People said, it really shows in the fact that at this late date we're finally getting some positives there. And I'm not sure how that occurred, but we did have one inmate that came in sick, and that is the one inmate that is infected now with COVID-19. And but I am very pleased with the sheriff and his department with that with their response and their ability to have not had any positives until this late date. Thank you.
Thank you. So Dr. Peoples, if you're on, the question is, what are the guidances to help go get a haircut or go to the hair salon? And then also for our restaurants, guidance on how to safely serve dine-in customers.
Thank you. So I will share, in just an interest of brevity, that we have some information posted about this on our website. State of Arizona did put out some guidance for restaurants, and also there's some CDC guidance as well that is on our website, so people can refer there. But again, as people are out and about and making the choice to go into restaurants, get haircuts, take care of whatever life business they need to, definitely wearing a mask, having your hand sanitizer. And then I know that those business establishments are working on their own protocols within each of their individual work organizations. So in some of the restaurants, for example, tables are going to be set further apart than they used to be. You may have a wait staff that is now wearing a mask, which certainly would be best practice. And we're all just going to have to be patient as we adjust to these new norms. And it's a little different talking and conversating with somebody through a mask. But those are some things that the different restaurant entities are looking at doing as they implement their best practices. And again, these are just best practices. There are no rules that these entities have to do this while they open. But I know that it has been very important, at least to the restaurant owners and business owners that I have come into contact with and that have asked the health district for help and how can they open safely. This is incredibly important to people as they make their their livelihood and operate their businesses, that they are doing it in the best way that they can. So we've been really pleased to have that interaction. Thank you.
Thank you very much. So I apologize. We had a question posted. Supervisor Archuleta, do you want to comment or should I move on?
No, go ahead and move on. Thank you.
Okay. So we did have a question here, and I will ask the recorder Hanson just to be ready. If you want to answer, just throw in a comment to raise your hand. I know you're on the call. But for the board members, there's a question about the status of ballot by mail and the conversation about how we will vote in August and November and where we are going in that process. That is also involving the recorder, but I do want to let you answer the board members, and then I'll activate the recorder as well.
Well, thank you very much, Eric. And I think probably other board members will want to speak to this. And I would also encourage our recorder, Patty Hansen, who I know has been very active on this, and want to thank her for her leadership, and want to also give her the opportunity to respond. But in terms of ballot by mail, we are encouraging everyone to request a ballot by mail so that we can reduce the number of people going to the polls. We know that that is the safest way for people to vote, is to be able to vote by mail. It's also the most convenient way. And what we are doing is we are encouraging people to do that. We do not have a way to compel an all mail-in ballot election. And certainly our recorder, Hansen, can speak to that. But I would just say that there is great opportunity to be able to do that now, to request a ballot, to ensure that you can do that in the comfort of your home. Are there other members of the board that wish to speak to this item?
Like Supervisor Babbitt?
Thanks, Eric and Madam Chair. So, I do want to say, if Patty is on, want to give her that opportunity. But this is one of those frustrating pieces about having the legislative body of the Arizona legislature not being at work these last, I think, going on 8 to 10 weeks now. There's a number of things that only the legislature, in conjunction with the governor, can act on. And so there is this issue about not only what is safe for the election in terms of those voting, but then also, and is Patty on?
Yes, I am.
Great. So I will let Patty, you talk about the poll worker and operations piece, but and I will save that for Patty. But the big piece of this is the body that can make these decisions, that provides flexibility given the uncertainty of what our landscape is going to look like, not only in August, but to say nothing of November, once the respiratory regular flu season starts, has been one of the challenging pieces, because there's lots of work that could get done if they were in session doing it. And with that, I'll let Patty paint the picture of the difficulties and challenges around running a polling election, regardless of whether many people ask for a mail-in ballot or not.
Okay, thank you very much. I appreciate the opportunity to provide some information of what we're doing right now. Yes, we would like as many people as possible to vote by mail, and that you can do that easily by requesting an early ballot. We did a mailing to all the registered voters in the county, and it should be arriving any day now, where people are told how they can request those early ballots. You can do it online, by phone, or we included a request form with a postage paid envelope. But the challenge, that doesn't mean though that we can do away with in-person voting, and we don't want to do that completely, because we still have several voters that may have need assistance because of a disability or language assistance. And so what we'll be doing is really encouraging people to, those 2 weeks before the elections, do in-person early voting. So you can go and we can spread out the number of people that will be coming in person. So hopefully people would take advantage of that. So on election day, we have much fewer number of people who will be going to the polling place. And the thing to remember is for the security of elections, we want to make sure that our voters, the vote, and our poll workers, especially, and our employees are all voting in the safest manner. But our elections will go on, and we are doing everything possible to accommodate people in the safest manner. Thank you very much.
Thank you. And Supervisor Ryan, did you have any comments you want to add?
Well, actually, I want to fill in a few pieces that, and Patty, correct me on these pieces. But a concern, well, first and foremost, Patty, along with the recorders in the rest of the state, requested this early of the legislators. They did not, they were unable to proceed with legislation. We have also asked during our governor's calls that we were having quite regularly that this be considered. Points that Patty has made is even while we are trying to conduct the elections in the safest manner, it's not always easy to recruit people to fill the full boards. And so we do have a concern that we will have enough staffing. I'm sure Patty and her staff, her office, will continue to work to field those boards, and they'll do it in a good way, and they'll come up with safe practices. However, the more people that opt, even if you really like to go to the polls, you could ask for this primary and this general election because of the unique circumstance to do it by mail. And that would help all of us and help to assure that we get as many people that come out to vote to vote as well. Thank you.
Well, thank you very much. And thank you very much, Recorder Hanson, for helping to educate us. So we have about 10 minutes left, folks. Really appreciate you being with us. We're going to do a quick rapid fire here with Dr. Peoples on a couple things. And then Chairwoman Archuleta, we have a great question that I think would work to help sum up the night for every board member to answer, if that works for you. So that'll be our plan. We'll try to end right around 8 o'clock. Again, a reminder, all the questions that are asked tonight, both on Zoom, on the YouTube, and at board comments at coconino.az.gov will be answered in our frequently asked questions and addressed that we'll post on our website. Our staff is continuing to work on them, and we'll be getting answers up as fast as we can. So Dr. People, some testing questions. Bo on YouTube has been asking, we want to make very clear, when we say someone is positive, that is a result of a test, not of symptoms that have been just seen, correct?
Absolutely. We are not reporting at this time people that could be counted as positive due to symptoms. Some jurisdictions or agencies are doing that. If you see a positive, it's because someone's had a test.
Got it. So next question, can anyone who is willing to pay to get the antibody test from TGen or Sonora Quest? If so, how do we reach out and contact them?
Sonora Quest, yes. I am unsure about TGen. We will put the information on our website about how to contact Sonora Quest. They've contacted us and they are eager to work with individuals. Testing
Blitz is this weekend at King Street at our Health and Human Services, not Fort Tuthill, on Saturday, 10 to 3. Adriano is not showing symptoms, concerned that he may have been exposed. What are the standards that someone can come to the testing Blitz? Are there requirements?
Anybody, come one, come all. It's first come, first serve. We'll have about 400 kits available. Please come, wear a mask.
How long is it going to take to receive test results from the Saturday testing?
We had last Saturday's test results back within 4 days. So I'm hoping this Saturday will be 4 days or under.
All right. Dr. Peoples, thank you. Again, for those questions that are posted, there's still about 20. We will get them answered as we go through our time. But this question, Chairwoman Archuleta, comes from Mitch. It's a great one as we wrap up the night for our 5 elected officials, our board members on the call. First of all, Mitch expresses his thanks for your ongoing commitment in providing an open forum for people to talk with you. To the board members, so a 2-part question for each of you. What keeps you up at night as a board member for Coconino County? What keeps you up at night personally as a resident here in our great county. So Chairwoman Archuleta, whoever you want to have start, I'll let you determine the order here.
Sure. Well, those are great questions, a great way to round out the night. And so why don't we go with Supervisor Babbitt? Would you like to go first? We'll go with District 1, and then we'll just take it across, and I'll end up the night.
Yeah, great question. So what keeps me up at night in my capacity, especially relational to the topic we're talking about, is the right balance going to be met without unintended significant consequences of us opening the window that we are opening to get our economy and our society back together without undue health implications, including fatalities from this pandemic? And is that balance going to be the right balance? Nothing comes for free. Every action has a reaction. And we are trying in partnership with state and federal folks, not always on the time frame that we would like, or not always with the rollout that we think is appropriate for our communities, but it is what it is. And so we are going to work hard to ensure that as we open, those who are part of the vulnerable populations, whether it's underlying health conditions or age, stay very, very conservative in their interactions in our communities. Make sure they are cautious, make sure they are taking a very preventative view. Those who have less risks are going to start walking out, and we hope we have that balance right. The thing that keeps me up in my personal world is the same thing related to that with my family, and making sure that we are reasonable and judicious in making decisions that has really, really profound implications for some members of our community. Great question. Thanks very much for the privilege of being here tonight.
Great. Well, let's go to District 3. Supervisor Ryan.
Thank you, Madam Chair, and thank you for the question. Just a real quick answer for Everett. I'm forming a citizens committee in Munns Park to work together with the staff to see if we can find a solution for where to place the maintenance barn. And so you'll get more information as time proceeds here. In response to the question, what keeps me up at night? Before speaking to the pandemic, this job's 24/7. The answers aren't always easy, but you troubleshoot them. You work as hard as you can to coordinate with staff, to communicate with people, to try and figure out the best answers. When it comes to the pandemic, Art began to outline it. We're all wrestling with this one. We know we have an organism, a virus that can be transmitted. We don't have vaccines at this point. We don't have testing capability because of limited supplies. And in the meantime, in order to attempt to social distance, it's created a crisis associated with our economy. And then when it comes to the individual, there are many different levels. There are levels of people that they don't know what to do. They don't know what their future is and how to respond. What do you do for food? What do I do for my family? Even beyond that, we have a community that's been impacted. And yet, because we're social distancing, the ability to grieve has changed. The ability to gather together has changed. And it's very difficult for family members. And so we don't want to see that just expand in our community. And so, yes, these are items that definitely keep me up at a personal level, as well as in a representative role. We're trying as best we can to work with the best science we have available while working with our legislative capabilities and communicating the challenges we have within our community and trying to help get resources made available as best we can to our community members. So unfortunately, This is a prolonged pandemic, and it continues to unfold in a slow motion. And so most importantly, for anything, anywhere you are in life, appreciate those that are around you. Just reach out to them. Thank you, Madam Chair.
Thank you, Supervisor Ryan. We'll go now to District 4, Supervisor Parks.
Thank you, Madam Chair. I believe that the toughest part of this is the balance that's been mentioned before. The balance, as Supervisor Ryan said, and Supervisor Babbitt, between keeping people safe and not allowing our economy to completely be destroyed. We have, as we know, the small business is the backbone of our economy in this country, and the small businessmen right now are very worried about the very thing that has built their business, which is their dedication to their business. They are being deprived of that because now they're having to stay home and be basically shut-ins. They are very worried about what they've built and as their business. They're worried about their lives and the lives of their loved ones as well. So the social distancing and the masks and all those things are fairly minor as far as the business goes. Those things can be quickly remedied. I mean, we have masks. We have the ability to remove a few tables out of a restaurant and have some social distancing. It's kind of tough to eat at a restaurant if you have a mask on, but if the servers are wearing masks and the cooks are wearing masks, that's just right. What we are up against is people losing their lives while maintaining their lives. And what I mean by that is people losing their ability to have their business prosper, or at least not be lost, while they're trying to save their very lives from the virus. I worry that there is not going to be, when the Ebola virus was going through Africa several years ago, they had a process that defeated the Ebola virus and managed to save many, many lives in Africa and other countries as well. And that was that when people who survived the virus had built the antibodies within their systems, that was what they were able to remove blood from those recovered people and use that blood, extract the plasma, and from the plasma extract the serum that had the antibodies, and they could inject that into the people who had either tested positive or that were high risk that had not tested positive for that Ebola virus, and they were able to save many, many lives that way. Now in this country, we are allowed to a person who has recovered from the virus, this coronavirus, is allowed to give blood twice for this purpose. What that means is after the serum with the antibodies is extracted from the blood that is supplied, the pint of blood, they can inject 3 other people with that antibody serum. So each person who has recovered has the ability to save 6 other people. And I think that if we can make that a priority, people are talking about a vaccine, the way that viruses work, the way that they don't have DNA like we do. DNA is a double-stranded helix that has over 3 billion bits of information in it, and that is encased in the nucleus of our cells, every single cell we have. That tells our body what we are to be made of. That tells our body which cells are to be organ cells, which cells to be skin cells, and etc. So the virus doesn't have a nucleus like we have. It has one strand of RNA, which our DNA is made up of 2 strands of RNA. Their RNA strand only has 30,000 bits of information. This is why they're able to adapt and mutate so quickly. They can mutate quickly enough to the point where every single person who gets a coronavirus, a flu virus, or a cold, or this coronavirus, the COVID virus, they can mutate fast enough where everybody has a different virus, a different form of the flu, different form of COVID-19. So a vaccine is nearly impossible because chasing the different mutations of each person who gets sick with the virus is practically impossible. So I know that they're working on vaccines. I hope they succeed, but we've been working on a vaccine for the 1918 Spanish flu for 100 years, and we haven't got one yet. Washington, when he was at Valley Forge, he vaccinated the troops at Valley Forge and saved the army. So anyway, we're all going to be exposed to this virus eventually, and we are all going to have to live through it with the antibodies that we have in our bodies, unless there is a cure that comes along these lines. And I suppose that's what keeps me up at night. Thank you.
Thank you. Supervisor Fowler, District 5.
Thank you, Madam Chair. And thank you all for joining us again. There are a number of things that do concern me. We still have children that do not get their meals during the day. There's been a lot of coverage on that. The students don't even get their homework. I'm really concerned about our students falling behind. We don't have a lot of places. We don't have internet, so that means that they're not able to go online and do classes. So the schools have to be more creative in delivering the services. I'm concerned about the businesses, the micro businesses, the self-employed independent contractors. Were not able to really benefit in the stimulus dollars that came through. I'm concerned that the banks have already decided some of the banks are not going to be involved in the stimulus packages that are for small businesses anymore. So I'm really concerned about that. I'm concerned about the mental health of our workers, the first line responders. I'm concerned about families, our own communities. I'm afraid that we're going to have PTSD that are going to be impacting our communities, and that our health, mental health providers are going to be so critical in this time. And we really need to really pay attention to that. We all need to take care of ourselves mentally, emotionally, and really be kind to each other. This is the time that we all have to come together and to say nice things about each other. That's what I'm concerned about also, because that is mental health, and the words that we use are very sacred, and it can hurt others. It can also bring really good thoughts and good blessings to people. So the way that we talk is very important. I'm really concerned about the second wave that is being discussed. How are we getting ready for that? And that's some of the things that we're talking about. And every day on Facebook, everything's gone to Facebook and Zoom now. Every day I look at Facebook and we're losing loved ones. I can't even hug them. They're relatives, and I have to we are mourning on our own by ourselves with our, we're lucky to have family members with us. Then we do it with them. We can't touch them. We're just have to deal with it by ourselves. And so those are issues that are really, really something that is personal, and we have to take extra care of ourselves. And I encourage everyone to take care of each other and touch base with people that you love, and with friends, and just encourage each other because right now we're all isolated and we all have to do our work from where we are. And we are going to continue as County Board of Supervisors to advocate as much as we can with the governor, with our congressional delegations, and we're going to keep on doing that because these are really critical services that are needed here. And yet our local governments have not been, haven't received any funding. We're just hoping that we do get some reimbursement. But those are things that really do concern me. And I'm concerned about our citizens in our county, and just really want to be able to somehow positively move on. We're learning how to live new ways of doing things. And those are challenging for some of our people. So just want to just really encourage everyone to take care of each other, and then check on your loved ones, because many people out on Navajo and throughout our county, we're a rural county. Many people, where they live, they don't even get phone reception. Their internet doesn't even work. So for that reason, maybe drive by and just wave at them or something. Just make sure they're okay. So I thank you all for joining us. We think about you, and we think about each other all the time. So just want to let you know that we're always working on your behalf and trying to create better lives for ourselves, for the county here. Thank you so much.
Thank you, Supervisor Feller. And thank you all for joining us for our meeting. Really appreciate it. And I'll just close out by saying what keeps me up at night is just figuring out how do we serve our residents? How do we provide the services to all of our residents, and protecting those who are most vulnerable? I mean, I think about people who are isolated, who have no family, who long for someone to talk to, for people who don't have access to technology, who can't do what we're doing right now, which is being able to see one another, to be able to actually have that human interaction. I think about children. I think about children who are seeing parents struggle because they've been laid off of their jobs, and they're worried about where they're going to get their next meal, or having to decide between buying a medicine or paying a bill. That's what keeps me up at night. 5 generations of my family have lived in Coconino County, have lived in Flagstaff. My family, one of the first Hispanic pioneer families. And so what personally keeps me up at night is just thinking about the community that I love. I have an extended family, and my community is my family. I have my own personal family, and of course I worry about them, but I worry about the community that my ancestors helped establish here in Flagstaff. I worry about the Flagstaff and the Coconino County that we all love and know. And I want to make sure that we extend ourselves to everyone, that we care for one another, that we are patient with one another. These are really unsettling and scary times for many, and so we have to put ourselves into the shoes of, our neighbors and see the world from their perspective as well, and do all that we can to help out. So that's what keeps me up at night, just continuing to think about what I can do as a public servant, what we can do at the county level, and what we can do as a community to make sure that we're extending our love out to one another and caring for one another, and that we never lose that community spirit. That's the foundation of who we are in Coconino County, and I believe in that, and I believe that all of us will be resilient, and we will get through this together, but we will need to depend on one another. And so that gives me great hope, because I know that all of us are in this together. And so from all of us on the Board of Supervisors, from all of Coconino County, from all of our elected officials in Coconino County, we thank you very much for joining us. We wish you good health. We ask you to take care of one another, check in on one another, and we will have more of these town halls. We will answer the questions that were not answered live or via this town hall. They will be put out on our website and will be shared so that you can get those questions answered. And we look forward to seeing you at our next town hall. And in the meantime, I'll send you a little sign that my 11-year-old sends, which is a heart, wishing you love and peace and good health. Thank you.